They observe healthy behavior and unhealthy behavior. They observe mistakes and effective strategies. And out of this they grow, they learn, and they improve.
Dr. O'Sullivan, what other therapy options are available for people suffering from depression who have not responded to CBT, whether it's because it wasn't suitable, it just hasn't been effective?
Well, this is again something you can discuss with your doctor, because there are many different treatment options. And these include conventional psychotherapy, day programs usually attached to hospitals, day hospital programs, medication management, even inpatient therapy, and group therapy.
What do you mean by traditional counseling or therapy?
Well, traditional or conventional therapy takes into account the totality of the person's experience, their personality, and what they've been through in life. If we think of CBT or cognitive behavior therapy, it's more focused, goal-orientated, and time-limited. Conventional therapy is more flexible and takes into account these other things I've just described. We have psychodynamic therapy that looks at the past and links the past to the present. Therapy will look at family history, and the person's life experiences. Psychotherapy can also be understood as family therapy or couples therapy, and then I mentioned earlier, group therapy.
Could you talk to us more about group therapy?
Yeah, group therapy is a form of therapy that involves 3 or more people. Usually the groups are 10 to 12 people in size, although with AA, Alcoholics Anonymous, you can have much larger groups. But group therapy is therapy in the setting of other people, a shared experience. And in the group, the person learns that they're not alone with their problems. Problems are shared by other people. In the group, there is a discussion of problems, and the person observes, witnesses other people, other group members attempting to solve their problems. They observe healthy behavior and unhealthy behavior. They observe mistakes and effective strategies. And out of this they grow, they learn, and they improve over a period of time. Usually groups meet once or twice a week, and the group duration is for 1 to 2 hours.
And day treatment programs sound very interesting. Could you tell us more about those?
Yeah, day treatment programs are comprehensive programs that will deal with more complex depression without having to admit the person to hospital. Usually a person will attend 3 to 5 days a week and 4 to 6 hours a day. The approach to treatment is a team approach, and the team consists of perhaps a social worker or social workers, psychologists, nursing staff, psychiatric nurses, and programs usually have access to a psychiatrist. And the treatment provided will be a reflection of this diversity in the professional staff. So treatment may include individual counselling combined with group therapy, or individual counselling combined with stress management techniques, social skills training, problem-solving strategies, mindfulness, meditational groups, medication management, and then sometimes inpatient treatment may be considered if a person is going through a difficult time during their attendance at the program.
You must get to know a patient quite well in these programs. Are there any benefits to that?
Yes, that's, I think, one of the big benefits of a day treatment program, because sometimes they're attending every day and you get to know them. You get to know them through their behavior, how they relate to other patients, how they relate to staff. And in this way, sometimes behavior patterns emerge that clearly indicate have been a problem for the patient and may be a factor in their failure to respond to treatment. And the identification of this behavior can be very therapeutic for the patient and improve their prospects of recovery.
And I suppose you find out also if people, come in on time and how they conduct themselves in that way.
Absolutely, and the compliance issues become very quickly apparent. And again, that can be very helpful because, again, it may be an explanation as to why in the past the person has not done well in treatment.
How do you decide on the right treatment for a person with depression who hasn't responded to cognitive behavior therapy?
Clearly, it's important to talk things over with your family doctor or with your therapist, or think in terms of getting a second opinion. And again, as always, with your family doctor, discuss the experiences of the treatment you just had. What worked in treatment? What didn't work? What can you learn from that? Are there any issues that have emerged that are new to you? Has treatment uncovered problems that went unrecognized or you were unwilling to acknowledge? And this is a good start in the assessment process.
Should family be involved in a case like that?
With the patient's permission, it's always a good idea to see either a close friend, a trusted friend, or a member of the family to get their perspective, to get a more objective perspective of the person's lifestyle, their choices in life, how they cope with stress, and to what extent the depression is incapacitating the patient.
Can you expand on the role medications play in therapy?
That's especially important where the depression is serious or severe, because the problem in treating depression is that with the more serious depressions, you have apathy, lack of motivation, poor concentration, a sense of hopelessness. And this is where antidepressants can be very helpful. In treating these symptoms, the person gets some relief from hopelessness, apathy, lack of motivation. And in doing so, they're able to commit themselves much more effectively in the work of therapy.
Who can conduct psychotherapy, including CBT and the other therapies that you've mentioned?
Well, usually people working in therapy are mental health professionals, of course, social workers, psychologists, nurses, psychiatric nurses, and of course psychiatrists. An accreditation they receive from the local licensing authority or the registering body that has jurisdiction in their area. A therapist will have gone through accredited training, and that would include supervised clinical training. They will have attended workshops, lectures, and seminars. Once they're trained, the therapist will be expected to participate in continuing professional development, and over the years they will continue to attend seminars, workshops, and lectures to maintain their skills and even enhance their skills.
Are the videos and the information online and in books useful resources for people?
It's fair to say they are. I mean, to be self-informed is so important. Knowledge is power, as they say. A person with any illness or any disorder should make sure that they educate themselves about the illness that they're dealing with. Mm-hmm. Having said that, it's important that you don't jump to conclusions about your illness, that you don't misdiagnose yourself. So it's important to get advice, professional advice as well. And also you have the issue of misinformation, that a problem that occurs online, misinformation or disinformation. And this is something that we have to be very aware of, because online there are so many people so willing to provide advice, and this advice may not be accurate advice, mm-hmm. and can be quite dangerous.
Thank you.